So tonight, I guess I just wanted to go over sort of basic kind of concepts that I think of when I'm, or kind of what I'm looking at when I'm looking at a horse, you know, and especially even like a new horse that comes in and I'm kind of sort of deciding what to do with it and sort of some of the tools that I use to like make those decisions. I am a business partner in Red Oak Equine Associates. These pictures are a little dated. We have some other employees now, but we are a multi-farrier practice that works, like Michelle said, up and down the East Coast. We're based out of southeastern Pennsylvania, but we have clients in New Jersey, Virginia. A lot of our clients come down here in the wintertime. A lot of them go down to Florida, to Wellington, to Ocala. So we're kind of like all over the place. And as of right now, it's myself, my business partner, Todd, Meister, and then we have 1, 2, 3, 4 employees. So, so the first thing I wanted to talk about is a little bit of anatomy, and I won't go like crazy deep into any of this stuff. When I'm looking at a foot, these are like landmarks that I'm looking at sort of to decide how to trim, how to shoe, things like that. So can you hear me? Is this helping? Yes? More volume? There's volume. Can you hear me now? Yes. Okay. So the hoof wall is basically what we're nailing the shoe to, and that's kind of that outside perimeter area. Okay, and then you have the sole, which is all of that area inside the hoof wall, inside the white line. And that sort of can be all different kinds of, is it working? It can be all different kinds of like densities, thickness. There can be a lot of, sometimes you come to do a horse and there'll be a ton of what we call dead sole in there. Sometimes there's not much. So all these things I'm evaluating when I'm looking at a horse. The bars run down. They're actually an extension of the hoof wall that come around and sort of dive down into the sole. And that's a part of the foot that I'm looking at to sort of decide where the sort of internal structures of the foot are and where I'm going to place my shoe. So that's one area that I specifically look at. White line is not white, and it's kind of that waxy looking, you know, yellow color there. And the white line actually it grows off of the tip of the coffin bone. Okay, the solar margin of the coffin bone. It doesn't run the whole way up the foot. And that's the area where you're looking to, like, when you're looking at the shape of a foot and where you want your nailing, the white line is what you're looking at, because you want well, I'll go into that later, a little bit about nailing. Let's see. When I'm like kind of describing a foot to somebody, if I'm talking about like specific areas, we'll talk about the toe, which is, you know, that sort of dorsal part of the foot. The heels are back by the frog, and the heel bulbs are kind of that, you know, area, sort of chunky area there, back above the heels. Then there's your quarters, which would be, if this were the lateral side of the horse, this would be your lateral quarter. Does it say quarter on there somewhere? Oh yeah, right there. So that would be your medial quarter, lateral quarter. You have a toe quarter, a medial toe quarter, lateral toe quarter, you know. That way I can like specifically like pinpoint where things are and what's going on. You know, if a horse has a quarter crack or if a horse has a toe crack, I could explain a little bit better where all those things are. Hoof capsule anatomy. So inside the hoof capsule, you have 3 bones, basically. You have the bottom part of your short pastern bone, you have your coffin bone, and you have your navicular bone. And then you also have your deep flexor tendon, which runs down the back of the leg, over the navicular bone, and inserts into the semilunar crest of the coffin bone. The navicular bursa is like a kind of like a fluid-filled sac that's sort of, I wish I had a stick. It kind of goes like, it sits underneath the navicular bone, and it actually like sort of lubricates and allows the deep flexor tendon to sort of move over the navicular bone. So if you have a horse that's ever had like navicular bursa injections, that would be the spot that the injection went into. And you have the sensitive lamina and the insensitive lamina. So you can see on this picture here, this was a hoof capsule that was actually removed in whole at a dissection that I went to. And you can kind of see all this stuff that looks like mushroom gills here. That's all insensitive lamina. The sensitive lamina would actually be, so if you look at the top part there, where there's like frog, that's actually the coffin bone with all the solar papilla on the bottom part, and the sensitive lamina would be on the dorsal side of that, which you'll see in another video. And then you have digital cushion, which is this kind of like fatty cartilage area underneath the navicular bone and underneath the deep flexor tendon. And what that does is it takes a lot of concussion as the horse is like moving and pounding on the ground. And that part of the foot, you can almost, when you look at a horse's foot, after looking at feet after feet after feet, you can kind of see like how much of digital cushion is there. You know what I mean? A contracted foot with very contracted heels and a tiny frog, it doesn't have like a very massive, big digital cushion that can like take a lot of pounding. And then you have the coffin joint, which is at the bottom of the short pastern, and then it involves the navicular bone, the short pastern bone, and the coffin bone. So if you're getting coffin joint injections, that's where they're going. The lamina are one of the most important parts of the foot because the sensitive lamina grow off of the coffin bone, and the insensitive lamina are actually part of the hoof wall. And the horse is kind of suspended inside that hoof capsule with these lamina, okay? And they kind of come together like this. So they interdigitate. And you can kind of see on that picture where they're coming together. And each one of those areas where the sensitive lamina and the insensitive lamina come together, then there are also these secondary lamina that come off of each one of those, and they also connect. And it's a super strong connection. If you've ever, I'm sure you've never, but I have actually tried to pull the hoof capsule off of a dead leg, and it's tough. Like, it's not easy to get those things apart. And when you have a horse that has laminitis, what's happening is, for one reason or another, either chemical or concussion related, those lamina are actually like tearing apart. And that tearing is what's causing all the pain for the horse. And a lot of times, so like every time the deep flexor tendon pulls on that coffin bone, the coffin bones are rotating down and the lamina are tearing apart. And that's why you get, if you've ever seen the bottom of a horse's foot that had laminitis, or is in the process, mostly had laminitis, the white line at the toe it goes from maybe this thick and then it just stretches out. And you can actually see all the lamina in that area. There's a video here that shows, so this was also part of the dissection that we went to. And in this video, we're actually removing the sole from the coffin bone. And you can see how difficult it is to get off. But the reason I put it on there mostly is because you can really clearly see the sensitive lamina on it's a little, if you don't like gross stuff, maybe just close your eyes. So all this kind of mushroom gill area here, that's all sensitive lamina. And that foot's in a vise, and you can see Dustin was actually pulling that off, and he's like pulling to get the sole off of the foot. Oh, it's just replaying. Okay, so with all that in mind, when I first see a horse, say somebody brings me a horse and they're like, we want you to shoe this, okay? The first thing that I'm gonna do is I'm gonna ask some questions about the horse's work. Like, what is the horse doing now? What has it been doing in the past? Where are you looking to go? You know, all these things kind of play a part in how I decide to tackle shoeing the horse. I'll ask questions about the soundness history, if it's ever had issues. If it has had issues, what those issues are. If it's had injections, how often does it get injections? You know, like, just so I have sort of a baseline idea of what's going on. I ask if it has any behavioral issues, if it doesn't like the hot fit, if it's bad for the farrier, if, like, you know, there's 5 million things. You guys know horses. And then I'll ask about the shoeing history, meaning, like, did the horse always wear open shoes? Did it wear pads? Did it wear bar shoes? Did it would, you know, like all these different questions just to kind of see. And then usually I'll just take a minute and look at the horse. I'll look at its body. I'll look at its, you know, legs, see how straight they are, if they're like pointing in every compass direction or if they're like pretty solid. And I look at its feet to see if the horse is standing square, if it looks like maybe the coronary band's tilted one way or the other, if it's pigeon-toed, if it's toed out, long toes, upright feet, all these things. And then I kind of assess the foot quality. Is the quality of the wall good? Is it falling apart? Why is it falling apart if it's falling apart? I'll pick up the horse's foot. And one thing, when I have people, a lot of times clients will be like, I'm gonna buy this horse. Here's a picture of its feet. You know, and I'm like, okay, can you pick up the horse's foot and take a picture of the bottom of it so I can see like kind of a little bit more of the whole picture. Like when I see a horse just standing there looking at its feet, it doesn't give me a ton of information to go off of. But if I pick up a horse's foot and look at the bottom of it, I can sort of tell how much mass there is there, if there's depth, how long the feet are, and there's a certainly like discrepancy between like length and depth. Those two things are not, so sometimes when people come to me and they say, oh, my horse's feet are very long, it might not necessarily be that the feet are very long at all. It might be that they just have no depth, you know? And I'll show you some pictures of that. I'll look at the hoof angle. I look at the coronary band. Coronary band's a really important part of shoeing, I feel like, because all of the hoof wall grows down from the coronary band. So it's one of the best indications that you can get when you look at the horse as to like what the actual shape of the foot is. Because everybody thinks, oh, it's like a block of wood down there, right? But it's very plastic. Hoof will distort and move depending on how the horse is bearing weight, depending on the moisture content, all of those things. So if you look at the coronary band is usually fairly, you know, at least shape-wise, static, and it's a good, like, gives you a good sort of baseline as to what the actual shape of the horse's foot is. And then I'll kind of look at the shoe wear and see if, you know, maybe the horse is wearing really heavily on the lateral side of the hind foot or something like that, or the toes are really wearing down, or so on the shoes. So the next thing I'll do is this not working?
Told to bring you another one.
I might just not know how to work it. Is I'll pull the shoes off. I just do want to take a minute to talk to you guys about this, because I just last week, somebody called me, a client from here called me, and I was in Pennsylvania, and they were like, I need to get these shoes off this horse. And I don't know how to do it. Is this one better?
Yeah.
Ooh, I sound really tinny on this one though, don't I?
Well, if you have to walk around, just throw it over your shoulder.
Okay.
And it's portable. What do y'all
No
think?
battery. You like this one? I sound like a cop. So there's two tools that we use to pull off shoes. The one on the left is called a crease nail puller. And that is probably, if you guys could get a pair of those and have a pair of them, it's probably the safest, best, easiest way to get shoes off of a horse without ripping its foot up and having your farrier come back and be like, whoa, what did you do? The other one, they're called shoe pull-offs. And I usually don't, when I'm pulling shoes off a horse, I don't really use my shoe pull-offs unless the nails are so worn down that I can't get them, because one, horses don't love it when you're like jerking on their foot and like bashing down and like, you know what I mean? Like they just don't, it's not, and it's really easy if you don't know how to use them right to just, especially if a horse has clips, to just rip off half the foot when you're trying to get the shoe off. So that's these guys here. They sell these at Tractor Supply. They sell both of them at Tractor Supply, but it'd be a good thing for everybody to have. Okay, so crease nail pullers. The secret to using these things is getting them in the crease of the shoe. And when I say the crease of the shoe, it's like it's called fullering, but it's like the kind of line that fills with dirt. Okay, the reason that's in a shoe is to give the horse some traction, because there are also shoes that are called plain stamp shoes where you just stamp the nail head in there and you drive the nail in, and like after 2 weeks, the whole thing looks like a sliding plate and the horse has no traction. So just having that little bit of area where dirt can get packed into the shoe actually really helps a lot with traction. What you want to do is get these things in there, and you want to clean out as much dirt as you can around the nail head by like pushing down and just scraping back and forth, and then get these jaws around the nail head and squeeze it. And a lot of times the nail head will just pop up a little bit, okay? And then you don't like pull up like this or like this or like this. These have a rounded jaw on them. All you have to do is, once you're locked into that nail, rock it forward or pull it back like this. I should turn this off. And it'll be a lot easier for you to get the nail out. So I had Dustin do like a kind of demo. See how the crease nail pullers, they like stay in contact with the shoe the entire time. And he gets in there, squeezes hard, and then just rocks the whole thing forward. And the nail should just pop out if you can grab it. If these things get old, a lot of times the nail head gets worn and you can't really get in there. That's when you got to use the shoe pull-offs. So shoe pull-offs, what you want to do is get them back underneath the heel of the shoe, and you're going to kind of rock it forward with a quick motion, but you always want to move these things towards the frog. Okay, so when you're doing that rocking motion, you're going to go in towards the frog on this side, in towards the frog, and then you can hit the shoe back down and pull the nails out with, just grab them. And if you get to the last nail, it's kind of stuck. You never want to go out or out. So you'll see like the last nail that I pull off here, I'm going to move the shoe pull-offs in towards the frog. And the reason for that is just that there's a clip there, the nails are there, and if you twist it out this way, all that hoof fall is going to just come ripping off. So you can see I just get the nail head so it pops up and then pull it out. And I know it looks easy when I do it, and it's like hard, but it's a really good thing to know how to do, because everybody is going to encounter this at some point where your horse is standing on a clip and blood's pouring out of there and you're like panicking and you want it off. All right, so once the shoe's off, then I'm gonna look at the horse's foot and I'm gonna kind of assess the balance. Okay, and there's sort of 3 different areas of balance that I'm looking at. Medial lateral balance, I feel like that's kind of the one that everybody sort of thinks of. The foot is balanced kind of this way and, you know, from side to side. So if you pick up when you see farriers pick up the leg and they're holding it and they're sighting it, they're looking for medial lateral balance. Hoof form balance is kind of like, if I'm looking at the coronary band, I'm looking for like, the foot should come out almost like a pyramid, you know what I mean? And it should also follow that shape of the coronary band. If there's things that are like wonky, giant flares, things like that, then that's telling me that something probably isn't right. Or, you know, sometimes from the coronary band, the hoof wall will actually curve under, which is sort of a difficult problem to deal with, but it's also something that I'm looking at when I'm looking at hoof form balance. And then anterior posterior balance is when everybody talks about their angles. Some horses' angles aren't right, you know what I mean? That's what they're talking about. So it's like, is there too much toe? Is there too much heel? So medial lateral balance can be a little tricky because when we're taught to shoe horses, we're taught that you pick up the horse's leg and you want a perfect sort of T from the cannon and the pastern to a level surface on the horse's foot, like this picture over here, okay? This horse was a horse that I was doing that was constantly getting quarter cracks on that medial heel there. And you can see that medial heel is like jammed up, kind of. It's not quite like a sheared heel, but it's definitely higher. If you look at the hairline on either side of the foot, you can see the medial part is higher. And so I started trimming the foot to try and sort of alleviate that. And you can see the balance there is not that. It's balanced to the coronary band more than it's balanced to the leg, okay? And really the only way that you can tell if you have your balance good is by getting a radiograph, by having balance films. And you know, some of the things you look at when you're looking at balance films is the coffin bone level to the ground. Well, that one's not level to the ground, but the joint spaces all the way down the leg are fairly even, meaning like none of those joints are compressed on one side or the other. So it's not really like a straightforward thing. You know what I mean? Like you kind of have to take it horse by horse, which is a lot of horseshoeing. There's no dogmatic thing you can just apply to every horse and have it all work out.
So Dan, that radiograph, that would be correct the way that horse needs to be?
Yeah, I think so. I mean, the joint spaces are all pretty good. It isn't level on the bottom, but sometimes if you were to lower one side or the other too much, you're going to be compressing joint spaces up higher in the leg. Anterior posterior balance is like when you're looking at a horse with no radiograph, what I'm looking for is a straight, what we call hoof pastern axis, which means the dorsal surface of the hoof wall kind of follows the line all the way up the pastern to the fetlock. So you don't want as opposed to it being broken forward where your fetlock's coming down here and your hoof falls like this, or broken back like this. And this is also another thing that I've learned over the years, that it's not always, looking at that isn't always that, okay? I have a horse that has he's an Irish horse, he has these huge platter feet, and the horse wears heart bars, and the vet came out to radiograph it, and she had called me, and I was like, man, I bet those things are like pretty flat or like negative. When I mean negative, I mean the palmar angle of the foot of the coffin bone isn't angled up like that. If you're looking at the bottom part of the coffin bone, it's either flat to the ground or even inverted like this. And she was like, no, actually they look pretty good. And I was like, I don't know that I believe that. And she sent them, and it's amazing. Sometimes what you see on the horse isn't exactly what's going on, like radiographically. So it's always, radiographs are super helpful. I love it when people get balance films because it just adds to my sort of library of what I'm looking at and what's actually going on inside there.
What's your recommendation for how often you want to do that?
I mean, if I was looking to change something, or if I was really unsure about a horse, I would want some balance films to look at it, and then I would say another 6 months. It would be good to see another set and see if like what I'm doing is making a difference, or if it's, you know, or how much of a difference it's making, you know, until you get things sort of back on track, or, you know. And then
When you get films in, if you kept the foot the way that you want it, and you're happy and the vet's happy with the radiographs, how often then would you need to do it? Will the foot pretty much stay the same, and then you're good every once a year maybe?
I mean, if you have, probably I would say if you have the same farrier doing the horse, then things, and they're on the same page as the veterinarian, and everybody's, you know, I think, you know, things should be fine. You know, like, I don't know that you necessarily need to be like taking balance films every 6 months of your horse's life to make sure that it's balanced, you know what I mean? But
Because their feet don't change that. As long as you're being consistent.
if you're being consistent, yeah. If you're changing farriers and things like that, that's very inconsistent. And horses just don't like inconsistence in any part of their life, from what I can tell. And hoof form balance is what I was talking about before, where I'm looking at the coronary band and making sure that everything is sort of coming down from the coronary band in like a nice, even fashion. So then I'll start trimming the horse. Really, one of the biggest things I'll look at is what I was talking about before, length versus depth. How much mass the foot has, how much dead sole or live sole. A lot of times, you know, on a thoroughbred in the wintertime, especially up in Pennsylvania, you'll go to shoe it and there won't be any sole. It'll just be all the dead sole will be like sloughed out just from walking around in the snow, and like looking at distortion and flares, coronary band, deviations in the coronary band. So that's one thing when you're looking at a horse from the top and looking at that sort of like hoof form balance, you can see sometimes there are areas of the coronary band that are raised, or, you know, things, it's not just like a perfect line all the way around. There may be a hump here or whatever. And so I'm looking to see if I see any of that, and if I do see that, why that's happening. And the shape of the white line can be, it's what you're looking at when you're nailing, but it can be deceiving because hoof is so plastic, and things will, if the horn tubules are stretching out, or if you have a laminitic horse, like, that's a landmark that can be sort of wishy-washy for you. So this is, when I'm talking about length versus depth, this is kind of what I'm talking about. So this horse on the left has like a good amount of sole depth, and its foot isn't, you know, it probably could be shod, but it doesn't look like it needs, you know, anything crazy. This one over here was a horse that ended up getting put down because it foundered and it rotated, and it sunk. And you can see sole depth-wise, from the bottom of the coffin bone down to the ground, there's not much. The horse is pretty much just walking on its sole. But lengthwise, like toe-wise, this way, there's a ton of extra length there. And sometimes you can get rid of that length by trimming depth if there's enough depth to trim, but sometimes with this horse, there's no depth to trim there, so you have to get rid of that in a different manner. You know what I mean? So once I'm trimmed, I'll start shaping shoes. Again, I'm looking at the coronary band to give me an idea of how that shoe should be shaped. Size-wise, I'm picking the shoe that covers the heels and gives it a little bit of length out of the back. When I'm shaping my shoes, I want to sort of decide where I want the breakover to be on the foot, as far as like where I think the shoe should be placed. I'm also looking at something called Duckett's dot, which is sort of just a guideline to help understand where on the foot the shoe should go. And I'm looking at the white line to decide where all my nailing should be.
Can I ask you a question about that?
Yeah?
So, without that X-ray, how are you, like, what are you looking at to gauge depth? Is it a feel, or like, what are the?
Yeah, so what I do is I'll trim the frog to what's called the true point of the frog, which is where you have like healthy frog tissue. Like if I don't do this with every horse, but if I'm like, I need to know how much depth I have here. Like if it's a situation where somebody's like, my horse's feet are really long, and I need to decide like how I can get rid of that length, whether it's trimming depth or whether it's placing a shoe in a different area on the foot. So I'll trim the frog to where it, or like right at the point where it sort of blends with the sole a bit. And then, I mean, a lot of it is just looking at lots and lots of feet. You know what I mean? So you see that, and you see where the frog's connecting to the sole there, and then from there you can see like from the hoof wall to that point, you know, like from the outer toe of the hoof wall to where your frog is trimmed, sort of how much depth you have there. And sometimes, like, you know, sometimes horses will grow a ton of sole, a ton of hoof wall. Sometimes horses will just grow hoof wall, and there's like no sole, you know? So it just, I hate to say that it's experience, but it's just, you know, you have to just see feet and see feet and see feet to kind of understand how much depth and length is there. So this Duckett's dot was this idea that was developed by an English farrier named Dave Duckett, who actually moved to Pennsylvania. And it's kind of a way to sort of look at the outside of the foot and try to understand what structures are inside the foot and where they're at, and then use that understanding to place the shoe where you want it to be placed. So that red line there is what's called Duckett's bridge, and what generally that line is around the widest point of the foot, and it's also kind of around where the bars start to sort of meld with the sole there. And if you look on this picture here, that kind of area sort of corresponds with the navicular bone and the coffin joint, okay? And the blue dot is Duckett's dot. That's an area that's usually kind of around 3/8 of an inch or so back from the point of the frog. And generally that area corresponds with the extensor process on the coffin bone. The extensor process is that sort of area that juts out of the top of the coffin bone. It's where the horse's main extensor tendon attaches to the coffin bone. So when I'm looking at those areas, I'm trying to decide like where that foot, when it breaks over, like where that actual rotation is, okay? And I use that then to place my shoe so that it's symmetrical as I can get it all the way around that point. So that's why when you see Farriers like setting toes back on shoes, this is kind of what they're trying to accomplish. Because if you, and it doesn't have to be done with every horse, like this is also not a dogmatic thing. And sometimes when you start shoeing a horse, you really have to like get it back into balance. But then as you keep shoeing it, things start growing properly and you don't have gravity working against you. I mean, basically all of this is physics and it's gravity. Like you're dealing with a lot of gravity on a heavy animal that's like pounding around doing stuff it probably shouldn't supposed to be doing. So anyway, what I'm looking for is from that area of Duckett's Dot and Duckett's Bridge to have sort of the same distance, so like a 50-50 split out to the toe of the shoe and back to the heels of the shoe. And then I'm also looking for symmetry in the foot. And if I can add a bit of symmetry with the shoe to help encourage the foot to sort of grow more under the center weight bearing of the horse, then I'll do that. So if you look at this foot over here, if you draw a center line down through it, it's very asymmetrical. That medial side is very straight. When I say straight, I mean if you're looking at the horse, its foot kind of looked like this side went out this way and this side came down like this. This horse is really pigeon-toed. So when I put the shoe on there, I try to get it centered around like 50% of the shoe on this side, on the medial side, and 50% of the shoe on the lateral side. And to do that, sometimes you end up having to, like if you look, this is the lateral view of the horse and it's fit fairly tight on this side. And this is the medial side of the foot. And it's fit very full and boxed to try to keep the horse from pulling the shoe off. This horse is another good example of like shoe placement. Its legs, when I first saw it, its legs were, they are crooked. They will always be crooked. But the foot was, you can see how offset the entire kind of hoof capsule is from the leg. And it had this really large flare on the inside. And when you look at its balance, the whole foot, it's almost like curving out this way towards the flare, okay? So when I put the shoe on there, it was fit like fairly tight to this side. I dressed that flare more and I fit it fuller on the outside. And you can see how like much kind of flatter the foot looks once the shoe is actually on there. If you pulled that shoe off, it would go right back to that. But that's all just where you're actually placing the shoe on the foot.
So if a horse is anatomically shaped that way, how long, like you can't be aggressive with it. Like how long does it take to sort of, like that's corrective shoeing, like how aggressive can you be without worrying about, like you talked earlier about the spacing in their joint.
Yeah.
If you went like, real aggressive, like, I don't know.
Well, if you get the foot trimmed so that the balance is correct and your joint spaces are all good, that's not going to change if you are trying to like encourage more symmetrical hoof growth by putting a shoe one way or the other. You know what I mean? Like, and then nailing. So when you're nailing a shoe on, You're looking at the white line, trying to make sure everything there aren't any flares or distortions on the hoof wall. And your nails should be located in the outer sort of edge or on the outer sort of edge of the white line, okay? And the reason for this is that is the deepest you can get those nails in that foot without a nail going someplace where it shouldn't go, okay? And if you're nailing outside of that, this horse doesn't have a really crazy thick hoof wall, but if you have a horse with like super thick hoof wall, sometimes it's hard to get your nails as deep as you can get them. But a lot of times, as the horse is moving and pounding on the ground, the shoe's moving around, and the thing that's like moving the most is the nails inside the foot. So every time those nails are moving, the hoof wall is getting like, wallowed out. If you have a horse that doesn't have very solid hoof wall, the hoof wall will break apart. So you want to get things as deep as you can so that you can get like the most solid attachment that you can. And you also want to fit the shoe in a way that when you're driving your nails, so ideally you put the shoe on the foot, and then your nails should be pitched to the exact pitch of the hoof wall when you go to drive the nails, okay? So they're not straight up and down. They're not angled out like this. You want the shoe wide enough on the bottom of the foot that when you drive your nails, you can angle them the same angle of the hoof wall so that they drive up the foot and out as high as you can get them. So lameness. If I have somebody call me and tell me that they have a lame horse that they want me to look at, the first thing that I'm going to ask them is, does the horse have heat and does the horse have pulse? And I would say 50% of the time people go, I don't know how to check for pulse. Or I'm not very good at that. Or like, those two things are really good indicators that the lameness is actually in the foot. And that you're not, don't take this the wrong way, but being called out on a Saturday because they don't want to pay a vet fee. I personally went to a farm one time to look at a lame horse on a Saturday morning. And when I got there, its hock was like this big. And I was like, that's $100. So checking for heat, the easiest thing to do is just put your hand on the foot and see if it feels any warmer in comparison to the other foot or any of the other feet. And it's a good thing just to, if you've never done that before or you don't know how to do it, just to start doing it. When you're tacking your horse up or when you're doing whatever, just put your hands on their feet and see what they feel like. After you bathe your horse, obviously the feet are going to be much colder. After it comes in from outside, if it's been in a stall all night and it's been standing in straw or shavings, they're going to be warmer. If they have bell boots on and they're inside the stall, they're going to be warmer. Like, there's a lot of different variations that a horse's hoof capsule goes through. But it's good to have sort of a baseline of your own horse. And then checking for pulse. Here's a little video. If you run your hand or your finger and your thumb down that superficial flexor tendon, that groove in between the superficial flexor tendon and the cannon bone there, and you slide it down over the fetlock, you should be able to feel two little arteries there. They're like little squishy straws. And if your horse has an elevated digital pulse, it'll be, sometimes you can feel a pulse, and you're like, oh, I think I felt it. And then you're like, and then you feel it again. But if your horse actually has an elevated digital pulse, you can probably take a heart rate. It's enough, you'll be able to feel it enough that you can take a heart rate from it, okay? And that's also a good thing to practice on your own horse. If you have a horse at your barn that has an abscess, that has an abscess, that's when you're really gonna feel a digital pulse. Or a horse that's laminitic will have, a throbbing pulse that you cannot miss. So if you if you want to practice that and you have a horse with an abscess or something like that, that's a good thing to try it on, because you can find that spot fairly easily. I'm stuck. Okay, so once I go to look at the horse, the first thing I'm going to ask is, how long has the horse been lame, and like what precipitated the event? So was the horse out in the field and just came in dead lame one day, or was the horse running cross country yesterday and now showed up a degree off today, you know? And I'm going to look at the horse and see how it's standing. Is it pointing one leg? Is it, you know, holding one leg up? Is it just standing there like a normal horse? I'm going to check for heat and pulse. I'm going to walk the horse and see how it's landing as it's walking. Is it landing toe first? Is it landing outside of its foot first? A lot of these things can all like give me an idea of where on the foot the horse is feeling pain. I'll jog a horse in a straight line and try to evaluate the degree of lameness in a straight line. If it's behind, if it's in front, which leg it's on. I'll lunge the horse in both directions. A lot of times you'll jog a horse a straight line and it's sound. People will be like, well, it's lame. You throw it on a circle and it'll show up in one direction or the other or both directions. And then I'll hoof test the horse to see if I can find anything in the hoof capsule specific that's causing it to be lame. A note on hoof testers, they're like archaic torture devices. Like, you could make any horse flinch with a pair of hoof testers. If you put your finger in there and somebody squeezed, you'd be screaming. There's a ton of leverage on hoof testers. And usually when I use those specific hoof testers for a reason, because they're kind of flimsy and the reins on them, which are the long part that you hold, they give a bit. They're not like, vets usually have like the beautiful, shiny hoof testers with big pokey prongs on them that I don't really like those things. So when I'm hoof testing a horse, generally what I'll do, I think I was trying here to show that, you know, this horse, there was nothing wrong with it. I was just hoof testing it to show that when I go around the first time, usually I'm applying like minimal pressure to see how the horse reacts. And then a lot of times I'll go around again and just add pressure to see if anything changes. When I'm hoof testing across the frog like that, if a horse reacts to that specific area, usually they're having some sort of like deeper pain that isn't necessarily associated with the hoof capsule itself, but it's probably more navicular pain. And horses, usually if they're having some kind of navicular pain, you hoof test them like that, the reaction is like, they can get really upset, like pull back and break cross ties upset. Abscesses, you guys have all dealt with abscesses. An abscess is an infection between the sensitive and insensitive lamina. It's usually very fast. So it's like one day the horse is sound, next day the horse is lame. And usually very lame. They can get like three-legged lame. A lot of times I feel like everybody wants their lame horse to be an abscess. Because that's an easy thing to deal with. But like I said, they'll have a really elevated digital pulse. It'll be throbbing. And when you hoof test them, it'll be like a very focal area where they're having pain. You're not going to get any sensitivity anywhere else. And then as far as like treating abscesses, what I generally tell people to do is, you want to have somebody come and open it up if you can. And if Farrier can find it and drain it, that's great. What I tell people to do is make a saturated solution of Epsom salt and hot water. So you want to pour as much Epsom salt in there until it just stops dissolving, and then soak the horse multiple times a day. And you don't want to, if you're going to throw it out, make sure it's wrapped. You don't want to get dirt and all kinds of stuff up in there. This was a horse that was having like a reoccurring abscess issue. And when I came to shoe it one time, it was 3-legged lame. Now, I put keratoma on there, but there's one of two things that happen with this horse. It either has a keratoma, which is that sort of half-moon shaped piece out of the coffin bone. And keratoma is just a constantly increasing mass of abnormal tissue between the outer hoof, capsule, and P3, which is the coffin bone. And what it does is it just sort of, it's a mass that grows and grows and grows. And eventually you get pressure necrosis in the coffin bone, which causes that missing area in the radiograph. But it'll also cause like recurring abscesses a lot of the times. I never really got a full confirmation on this horse. I'm actually going back to see it next week, I think. It also had a small spot. You can kind of see on the, I don't know if I can point to it. You can kind of see on the sole, in this area where that entire area was a subsolar abscess. Like the whole medial side of that foot was just, there was just pus everywhere in there. But it looked to me like the horse possibly had a puncture. Like if you look at the tip of the frog and you go kind of like 2 o'clock, you can see a little spot there. And something like a puncture would also cause, if it went unnoticed, it would also cause like reoccurring abscesses, especially if the horse got an infection in the coffin bone and then got necrosis from that as well. So it could have been sort of either or, but it's an interesting radiograph. The whole horse was kind of an interesting deal. That one I ended up just sticking a bar shoe on it. Basically what needs to happen, if it is a keratoma, it's not going to, that will not resolve itself just with time. What would happen is the horse would have to have surgery and have that whole area debrided and that keratoma removed. And if it was a puncture and it's infected, it needs that too. So this one's a really common one that I see, white line disease. Sometimes it can be just not a big deal. Sometimes it can be a huge deal. And a lot of times people, the first thing they'll notice is that right there, just a small, tiny crack on the toe of the horse. The reason horses get white line disease in that area is because the coffin bone has most coffin bones have an area that's called the mid-dorsal notch right on this like solar margin. And a lot of times there's just a little bit of a deviation in the white line there because there are terminal papillae that sort of reside on that border, and they are what grow the white line. So they're what make the white line and the insensitive lamina sort of come together. And if you have like a little bit of an area that isn't actually sealed properly, then you get bacteria and fungus up there and you can get white line disease. This horse in the top right-hand corner was actually white line disease as a function of laminitis. So once those lamina tear and you get that stretching, it's very common for laminitic horses to end up with white line disease too, because there's just so much like inconsistent attachment there at the toe. So, and then that one was just a fairly severe case of white line disease, so I ended up gluing some shoes on. But when I see this on horse, generally what I do, I prefer not to like go all crazy and resect a foot and have all this horse had a sycophus shoe on and an equipack underneath and like all kinds of stuff. If I can just open it up enough so that the client can get a nail in there and scrape out all that, you see all that powdery stuff in my hand there, and scrape out as much of that as you can and then treat it with Thrush Buster. I tell people to use Thrush Buster because Thrush Buster has gentian violet as one of its main ingredients, which is an antifungal, and it also has formalin in it, which just kills everything. But you do have to be very sort of on it. Like you can't just let it go, because if you let it go, then it can turn into that. And if it's the kind of thing that you don't treat every day, it comes back very fast. So when I'm shoeing for lameness, I'm going to evaluate the horse, evaluate the lameness, try to diagnose the reason. And the reason could be as easy as, oh, this horse has a sore inside heel, or, an abscess, or, things that are like easy for a farrier to deal with because it's actually like a hoof capsule issue, okay? But then horses can also be lame from like issues inside the hoof capsule that aren't directly related to the hoof capsule. And so you work with vets and try to, through radiographs, through all kinds of diagnostic things, figure out what's wrong with the horse and then come up with a plan about how to alleviate it. There can be like, just because I decide to shoe a horse one way and try to fix it one way, doesn't mean that that's the end all be all right way. Like there's a lot of farriers with a lot of different ideas, and they can, as long as you're getting the physics of the situation right, then, you could have the same outcome. And I always tell the people that work for me, like, if you don't know, don't be afraid not to be like, I don't know. Like, I'm not really sure. Don't be afraid just because you have a veterinarian standing there and you're like, you don't want to look like an idiot, But you're going to look like more of an idiot if you decide, I can fix this, and then you have no idea how to do it. I just wanted to like run down some different shoes that I use when I'm, dealing with different issues with horses. Glue-on shoes. The nice thing about glue-on shoes is they're extremely versatile. Like, it takes one whole thing out of the equation, and that's nailing. You don't have to be thinking about where your nails are going in the white line. When I'm talking about, like earlier when I was talking about like shoe placement and all those things, it's complicated by the fact that like, you can't just slap a shoe anywhere on there. Like there's a specific area that you're able to nail to, and you want to get a shoe in a specific area of the foot. So you have to work within those two parameters to like get things where you want them and have it safely nailed onto the foot. With glue-on shoes, it's easy to like, you can do all kinds of crazy stuff. You can cut like this, like that horse with the white line as used earlier had that huge piece of foot resected. I just cut out the cuff so that the client could access that area and glued it on. You can glue them on backwards. You can glue them on sideways if you wanted to. It doesn't really matter. Like, it's very versatile in that way. There's a bunch of different styles. Sigavoo shoes are the ones with the cuff up there. They actually glue to the outside of the hoof wall. The biggest issue with them is they're really great for some things, but some things they're not great for. They raise the horse pretty high up off the ground. They're very thick. They also cover up all that hoof wall, and they can cause like a lot of delamination underneath all that glue when you get moisture in there. The shoes up there in the left-hand corner, they're like fairly new. I mean, like when I say new, 10 years new. Those are the Sound Horse, I forget what they call them, flex shoes. I meant to bring one in here because they're really cool. And Polyflex makes a plastic horseshoe like that too, that you can actually get stud holes put in. I'm not a huge fan of nail-on plastic shoes because I think one of the greatest things about these glue-on plastic shoes is that they they flex a lot. And so it's almost like the closest thing you can get to having a barefoot horse with shoes on. Every time I put those things on and I come back, the shoe's inevitably wider than when I put it on. Because as the horse's foot grows down, it's growing down and out, right? And the shoe just opens up with the foot as it's growing down. And it's also great for like, you know, maybe a horse with a quarter crack that has a really jammed up coronary band. The shoe's gonna allow things to like settle out because it moves. I think they're really cool. They're one of the cooler plastic glue-on shoes are one of the cooler sort of newer horseshoe inventions that have come about recently. And you could also just take a regular aluminum shoe and just directly glue it to the horse's foot. So there's all different kinds, and this is like 3 varieties of glue-on shoes, and there's like a bazillion of them. So there's all different things you can do with them. The worst part about them is they're really expensive. Like a pair of Sigafus shoes, just for me to buy, some of them, they're like $100 just for one pair of horseshoes, you know. Equipack is something that I use a lot. I think it's really great. Inevitably, when you nail a shoe on a horse, it raises everything up off the ground except for the hoof wall, okay? And I don't, like, it's my feeling that a horse isn't just supposed to be walking around on its hoof wall. When you look at a barefoot horse, usually they have a nice frog. The frog's contacting the ground. The frog helps in circulation of the foot. The sole's contacting the ground. You know, as long as the horse has enough foot, it's not going to be lame from having its sole on the ground. So when I have a horse that has an issue where I feel like they could use some frog or sole contact, Equipack's really great. One of the things that I see sometimes is you'll see horses where their feet kind of grow down and just splash out like this, right? And I might have maybe the next picture. This horse right here, if you look at its frog is like descended down through, like that thing wants to be on the ground, okay? So you put a shoe on there and it's just drops down through the foot. And Equipack is great for getting that contact and getting some more depth in a foot, and it'll also help keep the foot from like running forward the way this one has, where the heels are like, you know, everything is like moved forward. This horse had very long toes. And the way I kind of think about it in my head is if you took like a paper cup and you just cut a triangle out of the back of it so it's kind of shaped like a hoof, and you put it on a table and you push down on it, it's just gonna like this, right? If you fill up that whole paper cup with some kind of material that can withstand that weight and you push down on it, it's not going anywhere. Okay, so horses with like hoof wall that doesn't have a ton of integrity, it can be really helpful for them. I put this here just so you can see when the Equipack's actually in there, everything is flush with the ground. So you're getting like frog contact and sole contact. Heart bar shoes. Heart bar shoes are great for relieving pressure on certain areas of the hoof capsule. So you have a horse with a quarter crack and you're trying to first off, if you have a horse with a quarter crack and it can get its shoes off and just have some time, that's probably the quickest and best way to get rid of a quarter crack, usually, because it just allows the entire foot. Really, a lot of horses, if you're having major foot problems and they can stand to have some time off, and I mean like some time off, not like a month. Pulling a horse's shoes is like a great reset button to just start back from square one. But heart bars, you can unweight. The nice thing about that is you're harnessing the frog and you can unweight certain areas of the foot wherever you feel like you need the coronary band to settle, or you have a horse with a sore heel and you're trying to, it needs to like jog up for cross country, and you need to just like quickly get it sound. They're great for that. They're also great. The horse that I was talking about earlier that had the Irish horse with the big platter feet where the radiographs were better than I thought they were going to be. That horse also had, it wasn't tolerating pads, so it wasn't tolerating any sole pressure because it didn't have a ton of depth in its foot, and but it needed some kind of frog support. So this is kind of how I address that problem. So you can use them in lieu of like other support materials. Suspensory and collateral ligament shoes. This is kind of a little bit of a newer idea, but the idea behind this is, so that horse on the left there has pretty bad suspensory desmitis. And I don't know, like this shoeing probably is not going to fix that for sure. Okay. There's really no good way to fix that. It's a degenerative disease. But if you have a horse that has a suspensory strain, shoeing like this can be helpful for that. And what the idea behind it is that if you widen up the toe of the shoe, when the horse is in soft footing, it's gonna almost like float the toe up. And I also ground both branches of the shoe down so that they would sink into the footing more. And you're in that way loading the deep flexor tendon. And by loading the deep flexor tendon, you're unloading the suspensory ligament. So when the deep flexor tendon is loaded, it acts as like a counter force to the forces that are pulling the fetlock forward. So, and when I say collateral ligament shoes, I don't have pictures of one here, but it's a lot the same idea. So if you have a horse that has a collateral ligament injury, so collateral ligaments, they're going to stabilize your horse's foot on an uneven footing like this. Okay. If you have a horse that has a strained collateral ligament, you can take a plate and you can weld it into one side or the other of the shoe. So you're making one branch wider and one branch a little bit narrower, so that, and you don't even have to do it with a plate. A lot of times I'll run a fuller or a creaser. So there's a specific tool that makes that crease in the shoe. You can run it down the inside of the branch and widen up the branch. So when the horse is in softer footing, you would put that wider branch on the side that has the collateral ligament injury. So when the horse steps in the footing, it almost floats that side up a little bit and doesn't allow it to twist and strain that ligament more. This is just, that's actually a shoe board for, that was one of our employees was doing a certification. I did want to say at the beginning of this, actually, if any of you guys are looking for, I know like we're in southeastern PA and we have like a ton of farriers there, and there's a ton of good farriers there. So people don't really have trouble finding a good horseshoer, but I know that some people do have trouble finding a good horseshoer. So the American Farriers Association does these certifications, and they're all voluntary. You can go and they test you on different things, on forging like this, on there's written tests you have to do, there's practical tests, and they have a whole directory online. So if you're living in a place where you can't really find a farrier and you don't have a good resource to do that, if you go on that website, you can look and see what farriers are in your area and what sort of levels of certification they've passed. But anyway, this is a shoe board for that certification, and you're required to do certain modifications to shoes. And these are all different ways to kind of address lameness or gait problems. Stud holes. This is another problem that we see often, where people are like, oh, my stud holes aren't working. And a lot of times it ends up that when they're getting tapped out, they're sort of stripping out the stud holes. So I did a video. I don't know how great it is because I think my hand's in the way most of the time. But when you're doing stud holes and you clean them out with a nail, you want to make sure that when your tap is in there and you're spinning it in, that it's not really feeling any resistance. And you should kind of go and back it off a little bit and go and back it off a little bit and go and back it off a little bit. If you're feeling a whole ton of resistance, then you're probably cross-threading the studs or stripping them out entirely. Or your tap isn't in there straight, which is what this video is. You can see how hard I'm pushing on this tap to get it to like get in there and how crooked it is on the shoe. I don't know how to work this. All right, so this is kind of the end here, but general hoof care. These things make a huge difference in the quality of your horse's foot. I only see them once every 4 weeks, 5 weeks. But a ton of moisture, a ton of bathing. If horses are turned out in the dew, like this is the kind of stuff that ends up happening to horses' feet. And especially in the summertime, flies and bugs. Like I think if I have clients that have horses that have feet like this, I try to encourage them to get fly boots. I think fly boots are super helpful because the more horses stomping and stomping and stomping, the more that shoe is moving and moving, and the more the nails are like, you can see this horse looks like every freaking nail just sheared the foot right off. So, and then bedding. Personally, I prefer shavings. I know everybody can't really do shavings, but if you do straw, it's really good if you can bed it thick enough that when they urinate, they're not standing in the urine, that they're like kind of up above everything when they're compressing all the straw down. Questions?
Do you have a theory on oil and using it? And also Paratex, on those?
Yeah, a lot of times I think Caratex is great. What's that?
Repeat the question.
Oh, she said, do I have a theory on hoof oil or Caratex or sort of general? I think Caratex is really good. I think it's good. One of the big reasons is also because it has formalin in it. So I feel like it kind of just sort of any nastiness that gets on the horse's foot is kind of killed. I'm not a huge fan of hoof oil. I feel like horses' feet adapt to the environment that they're in. So if it's crazy wet out, your horse's feet are going to be wet. If it's crazy dry out, your horse's feet are going to be dry. If you try to make your horse's feet moisturized when it's crazy dry out, then they're going to be out there with like hoof oil moisturized feet pounding around on dry, hard ground. And probably, that's not really the best sort of situation. A lot of times, like when I have people use Caratex, I'll have them use Caratex and then I'll tell them to take have you ever seen that Corona? I'll tell them to take Corona and just put it around the top of the coronary band. Or you can slather them with hoof oil all day long and it doesn't, their feet look great, they're shiny, but some horses it does not go well. So it's a little bit case by case.
Supplements. What supplements do you recommend?
I guess any of the ones with the biotin, Farriers formula. I don't know that I have one that I really, really think does a greater job than the others. I think like the ones with biotin, and I also don't know if they actually, if they make horses' feet better. Like meaning, if you had a supplement that caused horses to grow foot more, that's a great thing. Because horses that grow feet are a heck of a lot easier to deal with than horses that don't grow foot, But I don't know that quality, like hoof quality wise, I haven't really seen anything that's like, wow, this has really increased the quality of the foot. certainly I think I'll be like, oh yeah, this horse is growing a lot of foot. You know what I mean? But that can be helpful as well. Like dealing with a horse that doesn't grow foot is probably the most frustrating thing as a farrier, because you can't, it's just hard to make a lot of headway when you don't have foot to deal with.
I'm just going to follow up on the Farrier's formula of biotin. So many of the grains that you buy have biotin in them and have the supplements already in the grain. Are we just throwing more nutrition at them regardless of if the horse is going to grow hoof or not?
Right, meaning it's like how much vitamin C can you take before you just pee it all out? Yeah.
Way over the recommended dosage, but you're still
Yeah.
adding.
Yeah, I mean, I would say probably. I don't really know the scientific sort of data on how much biotin is enough biotin for a horse, but I would think that like at some point you're not really doing anything better. You know what I mean?
I had a question about the placement of stud holes. I've noticed that on some horses, it's not hugely off, but it can be off by an inch or two. Do farriers choose where to put the stud holes based on the conformation of the foot?
Sometimes, yeah. I mean, like if you have a horse that you feel like is going to be interfering, or you know what I mean, like you can sort of move them one way or the other. Generally, when I put stud holes in, I'm putting them in right at the base of the crease, because I feel like there's less chance of them studding themselves if they interfere, if the stud holes move up a little bit further on the shoe than all the way back at the heels. You know what I mean? But that's probably mostly what you've seen, is like either they're back all the way back at the heels or all the way up. Is that what you're asking? Yeah. Yeah, I don't know, you know, it's probably more just farrier choice than if they're, than like conformation of the horse, I would say. Anybody?
Another question.
Yeah.
What's your opinion on square toes versus rounded toes? And choosing which to do or not to do?
Yeah. When you say square toes, do you mean like setting shoes back, or just actual square toe?
Just taking the toe and making the toe more square in the opinion that the horse is going to roll over more effectively.
Yeah. Yeah. I mean, I sort of base that decision on what the conformation of the horse's hoof capsule is, and like feedback from the rider and what's going on with the horse. So if you're telling me your horse is tripping, or like things like that, then I'm probably going to be trying to like shorten the toe and get the balance a little bit better. But there's certainly horses that I will stick a toe clip on, and like I think a toe clip looks beautiful. It's like classy and nice looking, but I don't think it's for every horse either, And I also think that when you're placing the shoe like that, sometimes when you're first starting to shoe the horse, you end up moving the shoe to where you want it, and you end up with like a lot of toe hanging over there. But then as you're continually shoeing the horse, things will start to, because you move that weight bearing back underneath the horse, things will start to like stand up a little better and have a little bit more integrity, and then you don't end up having to set the shoe back as far, Does that answer your question or not?
I've just seen different farriers with different opinions, and I appreciate your opinion.
Yeah, I mean, like I said before, there's no like kind of dogmatic right way or wrong way to shoe a horse. And there's also not like, it's just, you kind of have to go with what the horse is telling you, what the foot's telling you, what the horse is telling you, all those kinds of things. Anybody else?
Yeah, occasionally on some of our horses, I've noticed when I'm picking up a hoof, that the shoe, particularly on the outside, it is actually curled around and actually touching the frog, so you can't actually pick out that side.
Yeah.
And I was wondering why they would be doing that, or is it causing a problem with pressure on the frog?
No, it's more of an issue with picking out the feet and cleaning them. Having a shoe touch the frog like that isn't generally a problem. Why they're doing that? It could just be that depending on the conformation or shape of the horse's foot, and the size of shoe you put on there, you might just have to to get the shoe shaped and on there and not have a ton of shoe hanging out where you think the horse is gonna pull it. You end up having to wrap the heels around a bit more. But you can always, you could also grind those heels so that there was a little bit more space there to get a hoof pick through there and
Basically, they're not taking an extra step of grinding the end down on it to get through.
Yeah, but I don't,
As long as it's not a problem, that's fine.
yeah. It's a problem if you can't pick the foot out and it has thrush back there and you can't get in there to deal with it. I've had, I have a farm where I do a ton of Friesians, and those things are, they're like prehistoric beasts, their feet, some of them. And you have to really, if you do not get after cleaning out the commissars very good and making sure that the grooms there can get in there, they get thrushed so bad it's disgusting. So, yeah. But as far as a shoe touching the frog, that doesn't generally cause any kind of issue. Mm-hmm. Anybody else? You good? All right, well, thank you. I appreciate you guys coming out tonight. Yeah.
Everybody next week, it is traffic for next week, so